Hi, I'm Dr. Dee Dee Curtis, and I would like to address what happened to Dallas Cowboy Marshawn Nealon. And I wanted to tell people, do you know that most cities have crisis intervention programs where they can help a person that is in a situation like what happened with him? And if you watched any of my other videos, my question was, at any time did they get a mental health professional involved with the situation with Marshawn Nealon? And I asked that question because I found out that the city of Frisco does have a crisis intervention team that should intervene when a situation like that was happening. And if you'll look at the information that they provided in their press release, it says that the initial chase started at 10:36. He was found at 1:31. That's a 3-hour time gap between that. And so my question was not to, in no way was I criticizing the police department or first responders, but my question was, you have a crisis intervention team. Was that team involved at any time before this young man decided to take his own life? It is so important that everyone knows that programs are available, because when during my research over a several year period, I found that many areas have these programs, but no one knows about them. In Southern Dallas County, they have a care team, but I asked them, how do people know that you exist? What number do they call? And how does someone reach you when they're in this crisis? I even asked people in law enforcement in a qualitative study. I asked them, are you aware of your programs in your cities, and do you utilize them when you are up against someone who is definitely suffering a mental health crisis? Do you get a mental health person involved in it? And most of them said no. And the trend right now, many cities have a mental health person available, a professional available at the time of dispatch. So in some cities, if you call 911, they will ask, is this a mental health emergency, or if this is some other type of emergency, is this a police or fire emergency? But mental health emergency is asked immediately. If a person says yes, then at the dispatch level, they do have professionals that can get involved immediately. So my question was not in any way to criticize law enforcement or first responders. My question was, if a program is available, did you utilize the program that's available? It is so important that we not only have mental health programs in cities all over the country, but it is also important that if they are available, that they are utilized and that they're utilized immediately. And I was so surprised.